You finish urinating, and then, without any warning, a sudden, involuntary shudder violently ripples down your spine. This experience is officially documented in medical literature as post-micturition convulsion syndrome, or PMCS. Despite how often it occurs, PMCS remains a medical footnote. It sits outside formal diagnostic classifications and has been the subject of very little peer-reviewed research. It is a strange physiological reaction, a routine, everyday bodily function triggering a full-body tremor. Tracing the cause of this reflex leads into the neural control room, where the body manages thousands of unconscious signals in real time. This shudder is the outward sign of a high-speed biological tug-of-war happening right beneath the skin. This silhouette represents the body's internal environment, maintained at a steady 98.6 degrees, the baseline for the most common theory, heat loss. It suggests that as warm fluid is expelled, the body loses enough heat to trigger a warming reflex shiver. But this chart compares that heat loss to the actual deficit needed for a systemic response. The energy lost during urination is minuscule, far below the threshold required to force a full-body contraction. The timing is inconsistent. The shudder strikes early, before heat actually leaves. Because the temperature math doesn't align, the cause must be a much faster neurological mechanism. That mechanism is driven by the autonomic nervous system, the control center for unconscious functions, which operates through two competing branches. First is the sympathetic nervous system, a manager keeping the bladder's valve clamped shut while maintaining blood pressure. But when you decide to go, the parasympathetic system takes over, signaling the valve to relax. To start urinating, the brain must execute an abrupt handoff of control from one system to the other. As the bladder empties, the internal pressure held by the sympathetic system rapidly plummets. This sudden release creates a micro-dip in overall blood pressure. The nervous system treats this dip as a systemic alarm, forcing the body to scramble and initiate an intense neurological overcorrection. As the body detects the falling blood pressure, it immediately attempts to stabilize the system. The sympathetic system responds by deploying a burst of stress chemicals called catecholamines to quickly restore blood pressure. The combination of the rapid handoff and this sudden chemical surge causes a momentary misfire in the nerves. This is the shiver. This process also clarifies why men report experiencing PMCS more frequently. It is a result of anatomical posture. This chart compares blood pressure curves based on position. Because standing already requires higher blood pressure, the drop that occurs when the bladder empties is much steeper, which triggers a more aggressive chemical rebound from the nervous system. The P-shiver is the physical shockwave of the body's internal systems fighting to stabilize a sudden drop in pressure. PMCS is a benign neurological reflex. It is not a sign of disease, infection, or a true neurological disorder. This layout distinguishes PMCS from more serious conditions like micturition syncope. True medical emergencies involve a loss of consciousness or prolonged spasms, while PMCS is a momentary tremor. The shiver is a byproduct of homeostasis, the body's relentless effort to maintain a stable internal state. The next time you experience this involuntary shudder, you are feeling your nervous system execute a high-speed balancing act.